Dermatitis is the general name for skin inflammation. This condition is often linked to symptoms such as itchy skin and rashes. Many individuals often suffer from dermatitis, which comes in various forms. The condition includes eczema, which causes a very itchy red rash. This rash will often cause little bumps to form on a person's skin, and in time these bumps can ooze until unsightly crusts form over them. Various factors can cause dermatitis. Following is some of the most common types of this skin condition. You have atopic dermatitis, which is commonly called eczema and is often inherited. Eczema develops during infancy, and a person with eczema may have rough patches of dry or itchy skin. Dermatitis occurs when a substance touches your skin and causes an allergic reaction or an irritation. This kind of dermatitis may cause rashes that blister, burn, itch, or sting. Dyshidrotic dermatitis happens when a person's skin can't protect itself. This mainly occurs on someone's hands and feet, and it causes itchy and dry skin that usually has small blisters. Seborrheic dermatitis is called cradle cap when it develops in infants. It often forms on the scalp. This condition can cause dandruff, red skin, and scaly patches. The symptoms can also occur in other areas of the skin, such as the chest or on the face. There's neurodermatitis, and it's linked to an itchy patch, which is usually triggered by stress or something that irritates a person's skin. There's nummular dermatitis, and this can cause oval sores to form on the skin. It usually occurs when a person suffers an injury to the skin. And finally, there's stasis dermatitis, and this is linked to skin changes caused by poor blood circulation. In an article published in the Journal of Alternative and Complementary Medicine, researchers from the University of California and the University of Arizona conducted a systematic search to evaluate the role of oral micronutrients in the development of atopic dermatitis. They reviewed 49 different studies and discussed how various micronutrients, such as vitamin C, E, and D, and trace minerals like zinc, selenium, copper, and strontium, are all linked to atopic dermatitis. They also highlighted how supplementation affects the severity of the atopic dermatitis. Ascorbic acid is well known for its antioxidant properties, which allows it to reduce oxidative damage to the cells. Studies reveal that urine and serum markers of oxidative stress are higher in children with atopic dermatitis than in those without. Increasing plasma vitamin C levels can help with atopic dermatitis management, as it improves ceramide production in the epidermis. Ceramides are the major building blocks of the skin's lipid barrier, which is crucial for the organ's barrier function. The best form of vitamin C is liposomal vitamin C, and you can learn how to make this cheaply and easily at home in an ultrasonic cleaner. The next best form would be a non-acidic, pH-buffered vitamin C, the worst kind being a cheap, acidic ascorbic acid due to its ability to cause stomach upset. Vitamin E. Tocopherol is a fat-soluble vitamin with antioxidant and anti-inflammatory properties. According to clinical trials, vitamin E supplementation improves skin itching and healing of lesions. Although vitamin E deficiency does not contribute to the development of atopic dermatitis, comparisons between vitamin E intake of people with and without atopic dermatitis suggest that it has a protective effect against the dermatitis. For the best quality vitamin E, you want to make sure that you get a mixed tocopherol blend. Another fat-soluble vitamin, vitamin D, is needed for proper immune function, specifically immune reactivity and skin barrier integrity. According to several studies, vitamin D deficiency increases not just the risk of atopic dermatitis, but also the severity of the atopic dermatitis symptoms. Vitamin D supplementation, on the other hand, reduces the severity of the atopic dermatitis in both children and adults. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Zinc and copper are trace minerals involved in cell growth and function. Human studies show that while hair and serum copper levels are positively correlated with atopic dermatitis risk, zinc levels are the opposite. Zinc supplementation also only improves the severity of atopic dermatitis in adults, because high doses of zinc may interfere with copper absorption in the intestine. Researchers recommended supplementing with both copper and zinc. Skin cells require sufficient amounts of selenium to ensure that they can fight oxidative stress, which is a major cause of inflammation. Meanwhile, strontium is said to inhibit skin irritation when applied topically. According to a cohort study, selenium deficiency in infants and their mothers increased the former's risk of atopic dermatitis, while strontium deficiency in infants also has a similar effect. Maternal strontium deficiency decreases the atopic dermatitis risk for infants. Researchers from Yonsei University in South Korea suggest that bathing in spring water is a safe way to treat symptoms of atopic dermatitis. Health experts at the University of Colorado's Anschutz Medical Campus examined current literature on the effects of cannabinoids on skin disease, and they confirmed that pharmaceutical products containing the compounds may prove effective in treating eczema, psoriasis, and both atopic and contact dermatitis. According to the senior author, the compound's most promising effects is addressing severe itch. It was also noted in one study where 8 out of 21 patients who used a cannabinoid cream twice a day for 3 weeks were able to completely cure severe itching or pruritus. You can see my other video on CBD and blood flow in the brain for more information on its potential benefits. Fish oil supplements can help to suppress flare-ups of dermatitis that allergies trigger, as well as provide other nutritional benefits. Its omega-3 fatty acids can help to boost overall immune and cardiovascular health. Doses can range from 3 to 9 grams per day of a molecularly distilled omega-3 EPA DHA fish oil blend. Hairless mice fed a diet with reduced magnesium and zinc levels were compared with mice fed a standard diet. Skin dryness and wrinkle-like changes, scratching behavior, decreased skin water content, increased transepidermal water loss, and raised blood immunoglobulin E levels were seen in the group receiving the reduced magnesium and zinc diet when compared to the control. You want to take magnesium in the form of magnesium bisglycinate. You want to start by slowly increasing your dose until side effects like stomach discomfort or diarrhea are noticed. Then you want to gradually reduce your dose until you're taking the maximum tolerable daily amount that doesn't cause any side effects. As magnesium is required by over 300 enzyme systems in the body, it can have profound benefits to health after a few months of supplementation. Collagen use has also expanded into the treatment of some dermatological conditions, such as atopic and allergic contact dermatitis. A review included one 12-week study comparing the effects of collagen supplementation on 13 patients with atopic dermatitis, using 3.9 grams of collagen per day. The patients that supplemented with the collagen demonstrated a significant decrease in immune response and in inflammation. After 12 weeks, skin eruption areas, disease severity, skin hydration, and itchiness were all significantly improved with collagen supplementation. Oxidative stress has been implicated in atopic dermatitis for more than 15 years, mainly in the following three aspects. First, the presence of oxidative stress. Second, increased oxidative stress during atopic dermatitis exacerbation. And three, decreased antioxidant capability. Powerful antioxidants like CoQ10 in the form of ubiquinol, taken at doses of 200 to 400 milligrams per day, may be helpful here. Also, astaxanthin at 12 milligrams per day, as well as the previously mentioned vitamin C and vitamin E. Turmeric. Experts recommend an addition of half a teaspoon of turmeric in the daily diet, or drinking it with a warm glass of milk. Turmeric can help cure seborrheic dermatitis, which is a scaly scalp condition that can lead to temporary or permanent types of hair loss. The strongest form of turmeric is curcumin extract. Doses have been studied ranging from 2 to 5 grams per day. But due to its low bioavailability, it should be taken with biopterin, which is a black pepper extract, or taken with an oil, such as coconut oil, butter, ghee, or fish oil, to help to improve its absorption. Some other home remedies would be to avoid exposure to certain plants, as dermatitis can be triggered by some irritating plants. You want to care properly for sensitive skin. If your skin is generally sensitive, prevent more rashes from occurring by taking necessary precautions, like wash new clothing and bed sheets or pillowcases before you use them. When buying clothing, opt for natural fabrics like cotton instead of synthetics or wool, which may irritate your skin. And use gentle soap and always moisturize your skin. Applying a cold compress to the skin's areas that are affected by dermatitis may help to soothe the itching and the burning sensation. Instead of water, you can also soak a rag in cold, whole milk. The protein in the milk can help to reduce the itching and to dry out the rash. Don't scratch your skin. It can be hard to resist the urge, but don't scratch. Doing so will only irritate it more. Your hands and fingernails may also harbor lots of germs, which can cause infections if you keep scratching your skin. If you believe that your dermatitis is due to an allergic reaction to something in your environment, you can prevent the skin condition by identifying the irritant and getting rid of it. Think of any recent changes that you've made, such as wearing new clothing or using different skincare products. In most cases, people are allergic to metals like gold, silver, or nickel. If you're wearing new jewelry or accessories made of these metals, stop wearing them and check if your rash goes away. There's many foods that can trigger dermatitis, such as peanuts, milk, soy, wheat, fish, and eggs. An anti-eczema diet is similar to an anti-inflammatory diet. An example of some anti-inflammatory foods would be fish and vegetables.